Hello. Hi, friends. How are you? So, I'm here again, and today's topic is post-COVID hair loss. और इसके बारे में हम बात करने वाले हैं और आपके कोई और भी अगर सवाल हैं तो आप पूछ सकते हैं. यू कैन आस्क. हाँ, प्लीज डोंट हेजिटेट टू आस्क योर क्वेश्चंस. I'm your friend Dr. Shal Gupta, and yes, we are going to talk about post-COVID hair loss today. Huh? So, as we know, COVID is so much rampant here in India and in other parts of world, and it causes उनकी आवाज बाहर से. And we know this is a serious illness, and a lot of people across the globe have suffered this, including myself. So, as we know that whenever somebody has a physical illness or like this, where we can have fever or so much of lung involvement, uh, it actually it causes a condition called telogen effluvium. So what is telogen effluvium? Your hair enter, we know there are three cycles of three parts of hair cycle. One is anagen phase, then catagen phase, and then telogen phase. So telogen phase is the shedding phase, and in shedding phase, I mean in telogen phase, once a hair enters into telogen phase, it falls in 3 months time. So uh, when we have COVID, during that period, most of the people don't lose hair. It starts, I mean, the uh, post COVID hair loss usually starts after 3 months, because the hair enters into telogen phase while you are having COVID, and then this falls after 3 months. Okay, so sometimes people think that, hi Naresh, how are you? I am great. Good to see you here. Arson, hi. Yusuf Ali, hi. Yeah. Okay. Netherlands time is, I think, around 4 hours, three and a half hours behind India time. So, yeah, one question which I am seeing here, Arson, I am 15 years old and my hair is falling since the start of lockdown. It's been 1 year since I am having hair fall. Please help me out. So at the age of 15 years, usually we don't see androgenetic alopecia or male pattern baldness, and mostly it can be because of some nutritional deficiency, or if you had COVID or maybe some other symptom, other disease, then you can have hair loss. So mostly you have to get your blood investigations done, like vitamin B12, vitamin D, iron. If there is deficiency of those minerals or vitamins, then you may lose hair. And obviously diet one has to take care of. So you should have a good amount of protein in your diet, arson, and that really helps. So you can contact the team, my team. They'll guide you about the diet, and things to eat and what not to eat. So that will help you. uh, Aradhana, so if it's mild COVID, then also hair sheds. See, when it is mild COVID, usually shedding is not that severe. So we can say it is kind of directly proportional to the severity of the infection you have. So if it is a serious COVID infection, then you can have more hair loss, and if it is not that severe, then obviously uh, the hair loss won't be much, but it can be. It can vary. So. Anjali, hello. I am facing problem of hair loss. There is a small bald patch. Kindly suggest. Okay. So Anjali, This small bald patch sometimes can be because of alopecia areata, where we see patchy hair loss, and the patch is surrounded by good amount of hair everywhere. And alopecia areata is an autoimmune disorder, and you can have in most of the cases the hair grow back, and you don't actually need to take a lot of medicines. But if it is recurrent, or if the patch enlarges in size, you should get a thyroid profile done, because this has a strong association with thyroid disorders also. You can contact our team, and you can share your pictures also at given numbers. Arson, how can I contact your team? So the number is 9999570494. So I'm repeating here, 9999. Uh, सत्या के आईडी से ना कॉन्टेक्ट डिटेल्स डलवाओ. So I'm posting contact details in this chat only, so you can get it there. So the number is 9999570494. So Aradhana, I got my scalp biopsy done, and it came out that I have TE and plus minus early AGA. So I have a question: is this confirmed that I have AGA, since it says see, Aradhana, in females, certain baldness or female pattern thinning, and it is not very severe, and you will hardly see any female going bald. So, telogen effluvium is a transient condition, which obviously is because of some kind of physical or mental trauma, while AGA is a big thing, and the AGA pattern is rare, like less common in females. But yes, it has to be considered in light of your clinical symptoms and clinical picture. So you can share your pictures with us, or and you can fill the contact form also. We'll add it in the description, and the number also, 9999570494. Sir, can thin hair be permanent? Ashish Yadav. uh, what kind of thin hair? I mean, you are. Please elaborate, Ashish. I did not understand your question. सर डैंड्रफ है 3 साल से, सिबोरिक और सर्कल सर्कल पूरे हेड में. सो हरिशंकर, डैंड्रफ एक कॉमन प्रॉब्लम है, बहुत लोगों को होता है. डैंड्रफ को रिड्यूस किया जा सकता है, कम किया जा सकता है बाय यूजिंग सम एंटी फंगल शैम्पूज, ketoconazole based shampoos. Sometimes in case it does not respond that well, we also use topical steroids, but it should be used under supervision of a dermatologist. आप उसको खुद से यूज़ नहीं कर सकते. ये डैंड्रफ कम हो जाएगा, पूरी तरह से ख़त्म नहीं होगा. वी कैन रिड्यूस इट. ओके. सिबोरिया में थोड़ा डाइट का भी इम्पोर्टेंट रोल है. अगर आप थोड़ा प्लांट बेस्ड डाइट लेंगे, जिसमें कि खूब सारा वेजिटेबल्स और सैलेड आता है, देन इट विल बी गुड. स्टे अवे फ्रॉम प्रोसेस्ड फूड्स, प्रोसेस्ड कार्बोहाइड्रेट्स, जैसे ब्रेड वगैरह रहते हैं, बर्गर्स, ये इस तरह की चीज़ें. प्लीज स्टे अवे फ्रॉम दिस. सो रमा जी, हेलो. So, what are the tests that one must do check for the cause of hair loss, and can ketoconazole shampoo cause more hair shedding and thinning? Shubham, see, ketoconazole shampoo is a good shampoo as far as dandruff, seborrhea is concerned, but one should not overuse it. Like the ideal frequency is like once or twice a week, not more than that. But people who have dandruff and scaling and itching, they need to do shampoo almost daily sometimes. So if you have been prescribed ketoconazole based shampoo, don't use it daily. Use some alternate shampoo which is like SLS, paraben free. In fact, I also was facing the same issue, so I made a shampoo for myself, and that's our own shampoo, and it really helps. So it can be used on daily basis, and in addition to twice a week application of ketoconazole shampoo. So, what are the tests? Tests, see, common cause is iron deficiency anemia, then protein deficiency can also cause, vitamin B12, vitamin D deficiency can also contribute to this. Sometimes we also see association with zinc deficiency. Um or if you have some androgenetic alopecia, sorry, in case you have some alopecia areata type of pattern, it can be associated with autoimmune disorders uh, like thyroid imbalance. So T3, T4, TSH levels also sometimes should be noticed. So depending upon the clinical symptoms, we actually suggest tests to the patient. Obviously one patient cannot undergo all the tests. uh, Then, okay, thank you, Anjali. Pradeep, hello. Arjun, thank you. Rama, I'm facing major hair loss after COVID. Please suggest is PRP helps. So, see, I told you I also had COVID infection around, I think, around 1.5 months back. So, post COVID infection, yes, see, diet plays an important part. One should take a good protein rich diet, and seeds, especially, you can have pumpkin seeds, chia seeds, mixture of seeds, flex seeds. You can have obviously breathing exercises like pranayama. These things help. And PRP has a good role. I mean, I'm myself going to take a PRP session next week, and PRP definitely improves blood circulation. It won't, because see, the hair which have entered into telogen phase, they will fall. uh, they will keep falling, but the transplanted, sorry, the hair which have entered in the telogen phase, they are going to fall. But uh, even if we do PRP, we cannot stop these hair from falling. But yes, the recovery rate of these hair improves when we do a PRP session. Yogesh, hello Yogesh. Sir, my patches also increase. आप योगेश आप कैसे हो? Hi. So my patches also increase with hair loss in frontal part of head. My age 20 years. तो आर के मेडिको, आपके पैचेस किस तरीके के हैं? आर यू टॉकिंग अबाउट मेल पैटर्न बाल्डनेस और एलोपेशिया एरिएटा? सो यू कैन share your pictures and to my team at given numbers. So Piyush, hello. प्रदीप सर, मेरा हेयर फॉल हो, रूट में वाइट दिखता है, क्या रीज़न हो सकता है? ये डैंड्रफ रहता है रूट में जो वाइट दिखता है, और थोड़ा सा स्केलिंग जैसा सा दिखता है, थोड़ा इन्फ्लेमेशन की वजह से रहता है। कीटोकोनाजोल शैम्पू आपको हेल्प करेंगे। प्रदीप, आप वो यूज़ कर सकते हैं। एंड in addition to that, you should have a good hair nutrition tablets. Those also help. There is a tablet which I prescribe to my patients that's named Hair Art. So that's a complete kit which takes care of all the nutrition. In fact, I'm also taking it post COVID, and it really helps in cases of androgenetic alopecia also. Rajesh, namaste. ऋषिकेश, आप हमारी टीम को कांटेक्ट कर सकते हैं रिगार्डिंग प्राइसिंग एंड ऑल। हरिशंकर सर, डैंड्रफ है मुझे, रफ या कीटोकोनाजोल शैम्पू से भी हेयर सर्कल नहीं में जा नहीं रहे। अगर आपको हरिशंकर कीटोकोनाजोल शैम्पू से भी फर्क नहीं पड़ रहा है, तो फिर आप एक बार डर्मेटोलॉजिस्ट को किसी को कंसल्ट कीजिए। यदि आप हमें कंसल्ट करना चाहते हैं तो दिए गए नंबर्स पे आप कांटेक्ट कर सकते हैं। Does thin hair always turn to complete baldness? Ashish, no, thin hair don't always, turn to complete baldness. Um, a lot of people have thin hair, congenitally thin hair. Sometimes because of androgenetic alopecia, you have kind of thinning of hair, but it gets stabilized at one point of time, even if a person is not taking any medicine. So having thin hair does not mean that you are going to go completely bald. We also have to see the progression of disease, the duration of disease. So if the disease has been very slow, that means that the chances, the probability of complete baldness would be less. But if this thinning has been there in a very small short period of time, then obviously there are chances that you may get completely, I mean, so you have to keep an eye on progression of disease. I'm 21 years of age and I have any received my hairline and temple and thinking to do a transplant from you. The hairline which you make is supernatural. Hotstar, hi. Thank you for your comments and appreciation. Yes, but at the age of 21 years, one has to be very careful. So we cannot overdo anything. It should always be underplayed. We, because once we commit and make a uh, low hairline, then obviously we are consuming a huge number of grafts at this time, and which your donor might allow at this time because the area of baldness is small. But in case in case we have thinning later on in the areas behind your transplanted hair, then it would be a problem. So we have to be very careful while doing a transplant in at the age of 21 years. So you can contact my team and share your pictures. We'll do the needful. Mahendra Yadav sir, please suggest for MR hair loss. आप अपने concerns एक बार महेंद्र शेयर करिएगा. I did not get your question. Sir, you told earlier that HT is not permanent. Then what we should do after HT to keep the result? See, Rajesh, hair transplant is not permanent because uh, your existing hair can thin out. Hair transplant is not giving any protection to those hair, and this thinning may continue, and you may keep on losing those hair. There are a lot of miniaturized hair also in the areas where we do transplant, and we have to take care of. I mean, those hair also improve on medications. So to take care of the hair. Transplant results, we should ensure that the existing hair don't thin out, or we should hold on to them as long as possible. Now for this there are obviously medicines including biotin, multivitamins, finasteride, dutasteride, uh, Procapil, Redensil, Minoxidil. So many medicines are there. PRP, Derma roller, and above all, your healthy diet and lifestyle, and a stress-free life where you don't think too much about hair loss or getting bald. Okay, so all these things have to be used cautiously. We cannot. And at the same note, I would like to add here that you need to um, at the same note, I would like to add here that we would also like to uh, use the donor thoughtfully. I mean, if we should not overdo the donor. I have seen this happening. A lot of patients who come to me for repair hair transplants, uh, they come and they have kind of depleted donor and very low created hairline, and then it is a big mess. And in fact, these days, because only FU technique is so popular, people go for second time, third time also they go for FUE sessions because they are being misguided. So in those cases, sometimes they say, doctor, I have done this, but now please do something for my donor. I don't want hair in this portion. Please take them out and put them in my donor area. So recently, last week, we did a case like this. So please be aware. And obviously, hair transplant needs proper planning. We should not overdo medicines. That is the reason why I don't prescribe finasteride to all my patients immediately after transplant, unlike so many other places where it is being done. So obviously I know that if I do this, the result of my hair transplant is going to look awesome, much better than what it is looking right now, much dense, and I would be attracting a lot of new patients because of that. But it is not good for long term prospects of my patient. Similarly, don't go for 4, 5, 6, 7 PRP sessions post transplant. That is again a gimmick, and please don't fall prey to such things. And then, donor. So, all the three things, medicine, PRP, and donor, all are important. So, hello, sir. And please accept this fact that hair can thin out, even the transplanted ones. So, we have to be prepared for that and plan for that. Boxer Ashu, hello sir. Soon I'll come to your clinic for transplant. Okay, thank you. Komal sir, मेरा vitamin B12 level 263 है और vitamin D hair vitamin D22 है. Hair fall बहुत है. ये reason है hair. This could be one of the reasons. Please get your iron profile also done. Maybe that might be again a problem. So, Komal, you can share your pictures and history with us. You can fill the contact form, which we are just putting, in the comment section. So you can copy the link of the contact form from there. Okay, and numbers also are there, so you can contact. Um, just a second. A lot of questions. Yeah. Sir, is Khadi shampoo better option for dandruff treatment? Ashish, you can try that. Okay. Sir, I have hair loss for 2 years. Please suggest me. Mahendra Yadav, please share your pictures and fill the contact form. So we will, yeah, we'll definitely see how we can help you. Sir, I'm 17 years old and I lost my 30% of hair. So, sir, please help me and give some medicinal prescription. Shalraj, you can contact the team at given numbers and share your pictures. We will help you. Okay. Uh, Minoxidil. So, Shalraj, we'll see first what is your condition, and minoxidil. See, one has to be very careful while starting minoxidil, and one should not start minoxidil without any prescription or without having doctor seen you. Okay, so minoxidil, once you start, it won't be easy for you to stop it because if you stop it, you have rebound hair loss. So start the medicine very carefully. Timely introduction of medicine and thoughtful introduction of medicine, keeping patients' interest first in mind is very important. Okay, many a times I see patients taking a lot of medicines. Maybe sometimes they are prescribed also, which should not be used at early stages of baldness. Okay, never start your treatment with all the medicines in one go itself. Lakshman, please contact the team. They'll let you know everything. Does headstand helps for blood circulation? Ashish, yes, headstand really helps improving the blood circulation. And those people who cannot do headstand, they can probably try wall stand or sarvangasan. So I myself not able to do shirshasana, but yes, I do sarvangasan. Mm, I'm having a lot of dandruff on my hair and eyebrow. So, Sachin, dandruff on hair and eyebrow sometimes can be because of seborrheic dermatitis. You need a proper medical evaluation, and there is important role of diet as well. So, you can contact my team. They'll guide you regarding the diet. Contact at the given numbers. Can you please share? Okay. Uh, Now, this is the contact form which you see, and we are also putting numbers also. Numbers, contact numbers. इसमें डलवा दो है ना. So, which yoga is useful in hair fall? See, abhi we discussed Sarvangasan, Shirshasana, that is like kind of very helpful. Breathing exercise, pranayam, where the blood circulation is more like it improves. That is also a good yoga for that. Many people do this. I personally don't have any experience with this balayam, but yes. It can also help. I have yeah, like my some of my patients told me that they improved on that, but I don't have any personal experience on that. So hello sir, suggest for me. I have lost Mahendra. I've answered. What is the role of tolerance in PRP sessions if we do PRP frequently? So Rishikesh, this is an interesting question. I in fact keep on discussing about this. 8 9 years back when I started doing PRP sessions, I was doing it every month, and within a year span, I understood that if I'm doing it like very frequently, like once in a month, the patient actually stopped responding to this. This was because of tolerance, and there were some patients who could not come at that frequency, and they came late, maybe at an interval of an year or so. And I saw that the efficacy of treatment was lasting longer as compared to those where we did earlier. And moreover, if we repeat the sessions, see, I always keep talking about this. If you have a significant difference after a PRP session, if you see a significant change, your doctor will also see that change. So if you see that change in the first session, and then you'll also see that the second, third, or subsequent sessions did not improve the hair growth even a bit. That means there is no use of repeating these sessions again and again, again and again. Rather than giving any further improvement, it is going to be harmful, because first you are taking unnecessary pricks, pain, travel, time, a lot of wastage, resources. It is a and blood also you are giving. Okay, rather than taking multiple sessions of PRP, go and donate your blood. You will get blessings of somebody, and that might help your hair. Okay. देन सर मेरे हेयर थिन है सब कहते हैं तो गंजा होगा ही होगा सर क्या? मियाँ खलीफा ठाकुर, नहीं नहीं, आप ऐसे डरे ना। बाल अ, मतलब देखो, आपके अगर हेयर थिन है तो ज़रूरी नहीं है कि आप गंजे होंगे। और लोगों का क्या है, कुछ तो काम है, लोगों का काम है कहना, कुछ तो लोग कहेंगे। लोग बहुत कुछ बोलते रहते हैं, आप उसकी वजह से अपने आप को दुखी ना हो, परेशान ना हो। ऐसे नहीं होते गंजे, और अगर आप चिंता करेंगे तो ज़रूर गंजे हो जाएँगे, है ना? So, Naresh, hello doctor. I have done early a hair transplant after all, but the backside of my head has some patches over harvested. The donor is weak, some hair are falling. This over harvesting is an issue, Naresh, and we all know this. And I keep showing such cases in my patients. So, in such cases, you know, because you have already done over harvesting and must have used these hair in the frontal area, so we cannot take out them from there. So, in case you have good body hair, and we can place some body hair into those patches. We can also do scalp micropigmentation. That also helps, the donor side, and it creates an illusion of fullness. So maybe a combination of both, where we do some hair and along with scalp micropigmentation, so that can help the condition. सो डैंड्रफ इशू नहीं है हेयर के टूटने के बाद, हेयर के लास्ट पर भी वाइट जो दिखता है वो सब प्रदीप इन्फ्लेमेशन की वजह से होता है, और इसी के लिए ट्रीटमेंट किया जाता है। जो भी हम हेयर लॉस के ट्रीटमेंट करते हैं वो ये कम दिखेगा, और आपका हेयर मजबूत हो जाएगा। Yes, Naresh, this is what we discussed. SMP makes the hair look thicker, and we do SMP. But yes, the problem is sometimes we see in our cases also that the color can change blue or green because of oxidation of this. So this is an issue which we see with this. So I generally don't do SMP of the entire scalp where you want to keep the shaved off head look. But yes, if you have hair, and if you keep long hair, I mean this much length or this much length, then SMP is a very good option, because even if later on it turns little greenish or bluish, still it adds on to that illusion of fullness. Karan, good evening. I am having a lot of dandruff on my hair. Sachin, I have answered this. Sayed, oh, thank you for the love and appreciation, Sayed. Uh, I have been using minoxidil for 3.5 years, but now my hairline is started receding. So this is what I always keep talking, Karan. I see this in my practice that when you use these medicines, be it minoxidil or finasteride, if you keep using them for a long period of time, after some time you will develop tolerance and the medicine stops working on that. That is the reason why I don't want to start all the medicines together. Now if you are not on finasteride, now adding low finasteride at low dosage can help you. Okay, maybe you can also switch to Procapil or Redencel. That can also help, and that is the reason why I don't want to prescribe. I don't prescribe my patients minoxidil twice daily. That means 14 applications a week. I generally give them 3 applications a week or so, and I have found that this works. And in India, you see, you get 10% and even 15% minoxidil, which does not make any sense. So people who are listening, please don't use 7.5 or 10% minoxidil. Daily, I see such patients who are given these medicines. The chances of developing tolerance with higher strengths is even high. A lot of oil on my scalp by small sand-like grains all over the head. Ketoconazole hasn't helped. So Shubham, in such cases, sometimes we just a second. Where are you? So we use topical steroids also, and sometimes oral antifungals also help. So dietary modification, Shubham, that is also very important. Lifestyle makes huge difference. Sunlight also is a very good factor. It really helps this condition, Shubham. You can try sun exposure, sun bathing, really helpful. सर एलोपेशिया का परमानेंट ट्रीटमेंट पॉसिबल है? आप एलोपेशिया एरेटा की बात कर रहे हैं रणछोड़ दास? तो एलोपेशिया एरेटा का हम नहीं कह सकते कि परमानेंट ट्रीटमेंट अवेलेबल है, बिकॉज ये रिकरेंट हो सकता है इन काफ़ी काफ़ी सारे पेशेंट्स के अंदर, मतलब हाँ. So also I'm very confident about hair loss, hairline which you make in of 21. I'm coming you next month, and all depends on you. I'm very much fine about my hairline you make and love your results. Absolute honor to meet you. Oh, thank you so much, Hotstar. I would really love to meet you. Anurag, your team is not supportive, I think. Uh, Anurag, we try to answer all the questions, and sometimes we have so many queries coming up, and we try to answer them thoroughly. So sometimes we are one or two patients or some patients. If we are not able to do that, please bear with us. As soon as my staff becomes little free from other patients, they'll definitely uh, solve your queries also. uh, Rahul, sir, can you suggest reliable hair transplant clinic in Mumbai? See, Rahul, I am not telling you even come to me. I am giving you some education, um, the information on the basis of which you can do your research. It will be helpful, and you won't fall prey to wrong things and wrong method, or you will understand that what is good for you and what is not good for you. Me telling you anything or anywhere is not good. And many a times I see people are scared of traveling. They think that and one of the reasons why they are scared of traveling is sometimes they feel that even if they travel once for hair transplant, okay, that's okay, but then they'll have to travel again and again to get those freebies in form of PRPs, 6 7 PRPs, which won't be possible. So I'm telling you that PRP, so many PRPs actually are not doing any good. They are harmful for you, and you don't need it. We generally do one PRP at the time of transplant, and then maybe if needed, maybe once 6 or 7 months after a transplant, and then once in a year. Oh, Ashish, okay. So would love to meet you, Ashish. Uh, Menstruation in COVID करे या नहीं करे? So cross to feather masturbation in COVID करे या नहीं करे? See, it all depends on you. If you have energy, maybe you can do. So I am having a lot of dandruff on my hair and eyebrow. हाँ तो मैंने सचिन आप answered. Shave eyebrow. Lovebirds. I'm planning hair transplant your clinic now. I'm in Dubai. What about cost? So lovebirds, Niche, we have given you. I mean, the contact number and the contact form is there. You can please fill it, and you can contact my team. So they'll give you all the details. Rahul sir, 85K plus for hair transplant is worth for grade 2 baldness. Only hairline and temples. See, Rahul, first of all, we should see how many grafts you need, whether we need a transplant at grade 2 or not, and then whether we are not, going too low, too down to fill it up. Maybe just a little bit of filling you might need. So, as far as costing is concerned, every clinic has its own criterias. And if you think that paying a high cost or paying a low cost, uh, paying a high cost means you will get a best result, and paying low cost means that you will not get a result, or maybe there is some problem with the clinic, or that's not the case. I have seen people, see, I do repair from all across the globe. Patients come to me from Europe, from US, from Australia, from Middle East, Turkey especially. A lot of patients come to us from Turkey, and that's the capital of hair transplant, the capital of the entire world. But see, in India, definitely I would say that we are doing better transplants here, and see, the thing is, while people don't pay attention to this, they pay more attention to the cost. And the thing is, uh, when you see the results, Rahul, I'm telling you, when you see the results, you will find a lot of patients where the results are shown with a big number of grafts. And it is not just about money. You are spending your precious donor, which is not going to come back. The donor is more precious than money. So if you see a clinic giving results with say 3000 grafts, 3500 grafts, and if you see a clinic giving same results with much less number of grafts, maybe just 1500, 1600, then obviously the clinic which is giving you results with less number of grafts is knows something extra, which the clinic which is giving you that result with more number of grafts plus more number of multi grafts, because if they are doing only FUE technique, then it means that you are utilizing more donor. That means you are depleting your donor of multi grafts, which might be needed in future. And thirdly, you have to see this also, whether the patient have been prescribed finasteride. And if the results are the results which you are seeing are a combination of bigger number of grafts, second, more number of multigrafts, that mean more number of hair, even with the same number of grafts. And thirdly, the role of medicine also. If these three things are there, then the result comparison is total mismatch. Please pay attention to this, because we pay a bigger price with our donor, and that's very important. And I would always tell you, choose a clinic which has expertise in doing both types of surgeries, FUE, FUT. If you choose an incomplete clinic, then you are in a problem. You sooner or later you are going to end up in between in a mess, Such clinics might do a repeat FUE in case you need another surgery, and that is going to be devastating for the donor. Okay, so transplant has to be planned properly. That is very important. And sometimes, when you go to clinics which have centers every part of India, they are here. I don't think you can sustain a very good and equal quality of results. Okay, so I think you think about all these things. How many days should we take medicine after hair transplants? Sarosh Hussain, very important question, Sarosh, which you have asked. And many a times I've seen this, because see, I'm telling you this, I share this because I do a lot of repair cases, and only that person can do those, I mean, repair cases, who is equipped with everything. That means FUT, FUE, body hair transplant, scalp micropigmentation, synthetic hair, you name it, we do it. But the thing is, when we see such cases, the problem is many a times patients were told at clinics that you don't need any medicine at all. So we see such cases also. Sometimes we see cases where they tell, you need to take these medicines for just 6 months and then you stop. Sometimes they tell you need medicines for 1 year and then you stop. Sometimes when you go after 1 year, they'll say, see, you need to take the medicine forever as long as you want to sustain the results. Otherwise, we cannot, what you call, we cannot, I mean, say your hair may or may not stay. So in most of these cases, the results which you are seeing are because of medicine. Especially I'm talking about finasteride hair. So I suggest my patients sometimes, just ask the clinic whether you are going to give finasteride to me. So if they say yes, definitely I'll be giving you finasteride. So say goodbye and tata to them and say, okay, we'll meet after 6 months once I have finasteride. Let me see how much hair I grow naturally. Many of you might not need a transplant at all. Note down my words. Many of you might not need a transplant. Uh, Finasteride or dutasteride, they are wonderful medicines, but they should be introduced thoughtfully, keeping your interests in mind. Neha, good evening. Then Muhammad Imanul Hassan, stem cell therapy versus PRP. See, Mohammed, a lot of things are being sold to you in name of stem cell. I am really shocked to see a lot of people doing stem cell, claiming to do stem cell, but that's not stem cell. So what is being given to you in name of stem cell is a bluff. Please don't fall prey to such things. There is nothing unusual or special about these things. So if you find anything special, or see, um, I've seen, I don't know how many of you know. Uh, have you ever thought that when you see FUE, it will be sold to you by so many names, um, DHT, DHI, I perfect, V perfect, C perfect, or you, I don't know. I mean, I just go crazy when I see all this, you know. So, but if you uh, see FUT, you won't find such names. Okay, so many a times things are being sold to you, and you will. You will spend entire life doing the research. What is the difference? What is the difference between this and that? And you won't know. Even I don't know, because there is no difference. So please tell me about female hair transplant, Manoj. So see, female hair transplant is obviously a very very tricky thing, because first of all we need to do transplant without shaving off. Those females who need transplant, most of those females have thin donor hair at the back of their head, and then that is a problem. And so in such cases, sometimes we cannot do the entire surgery by FUE. We have to combine FUT or FUE, and then creating a hairline, natural looking hairline, because most of the surgeons are accustomed to do hair transplants in males, and they don't have enough experience while dealing with females. So it can be uh, tragic. I'll put some cases. I have already put some cases on my channel. You can go and see. Mm, Anurag Shukla, I'm afraid my injection. So, see, there are so many things we are afraid of in life. You can work on your diet, you can work on your fears which you have regarding hair loss. And the biggest reason of hair fall is fear of losing hair. I'm again repeating, fear of losing hair is the biggest reason of hair loss. So, please don't worry. But if you command your brain that I won't think about hair loss, so the brain does not register, subconscious does not register won't, so it will read it as I will think about hair loss. So the best way to do this is heal your subconscious with either self hypnosis sessions or affirmations. And the best time to do this is when you are going to sleep. See, I'm a subconscious healer. I have a separate channel by my name, Dr. Shail Gupta. You can search it on YouTube. You can also follow me on Instagram and Facebook, Twitter. So see what happens when you are. I mean, you can do those meditations. They'll help you, and sooner or later, one has to grow out of the fears. So, sir, I can use derma roller point 0.5 in size. What? Yeah, point 0.5 size derma roller is good for self usage, and use it carefully. I have a separate video on derma rollers. So all you have to do is, see, whenever you are looking for something, any question, just type Satya Hair Clinic and your question regarding hair loss, and suppose Satya Hair Clinic derma roller, Satya Hair Clinic PRP, Satya Hair Clinic Finasteride, Satya Hair Clinic Minoxidil. So you'll get everything, है ना? इसको देखेंगे और आप पाएंगे कि हाई ग्रेड ऑफ बाल्डनेस या ग्रेड 4 ऑनवर्ड्स जब आप रिजल्ट्स देखते हैं, तो बहुत सारे पेशेंट्स में ट्रांसप्लांट जो किया गया है वो सिर्फ आगे आगे किया जाता है, पीछे तो एक भी बाल नहीं डाला जाता। और पेशेंट को जब फिनेस्ट्राइड दे दी जाती है तो वहाँ पर बाल उग जाते हैं। तो जब आप रिजल्ट्स को कंपेयर करें तो इमीडिएट पोस्ट ऑफ पिक्चर्स भी देखें, ग्राफ्ट को कहाँ डाला गया है, तो आप पाएंगे कि किसी किसी जगह पे बहुत थोड़े ग्राफ्ट डले हैं पर वो भर गए, किसी जगह ग्राफ्ट डले ही नहीं, वो भी भर गए। तो ये सब तो फिनेस्टाइड का ही चमत्कार है जी। Someone launched minoxidil 5% with finasteride in topical solution. Yeah, it's a common medicine these days, and I also use it sometimes in my patients, but should not be used as a first prescription. Oh, Brijesh ji, namaste. Topical is equally effective as finasteride 1 mg. See, Karan, there is no match. Like as far as I know, in my experience, topical finasteride minoxidil preparation is no match to oral finasteride. Oral finasteride, what I have seen in my patients, it gives way much better results because it's a direct DHT blocker which you take orally, and it is a different ball game altogether. So I think I've answered most of the questions, but there are still some left. But we are running short of time now, so let me just scroll through this. Karan said, "Which multivitamin do you recommend?" See, I have made a multivitamin preparation, which is a very good one, which I take as well. That is by name of Hair Art. So if you want, you can contact my team. We'll get it delivered. You can take that. That's a very good medicine, and it helps a lot of patients, and especially post COVID, wonderful for telogen effluvium. ठीक है, शैलराज आपको कांटेक्ट करेंगे, आपने कर लिया है तो। मानसून में मेरे बाल बहुत टूटे और ऑयली। मैं एक सेपरेट वीडियो बनाऊंगा सौरभ मानसून के ऊपर। नरेश, थैंक यू। बहुत सारे हैं, मुझे इसका कंपोजिशन नहीं मालूम। दिनेश, क्या है? इन्फ्लेमेशन के लिए कुछ होम रेमेडीज बताएं सर। आप थोड़ा ऑयलिंग कर सकते हैं प्रदीप, दैट ऑल्सो हेल्प्स। लोग सोचते हैं कि ऑयलिंग बहुत ख़राब चीज़ है, ऐसा नहीं है। ऑयलिंग हेल्प्स, काम करती है, फ़ायदा करती है। कैस्टर ऑयल आप यूज़ कर देख सकते हैं, इट हेल्प्स। Red peppermint essential. See, essential oils are good. Peppermint bhi hai. Then there are rosemary oil, castor oil. This is good. And Redensil, yeah, Redensil is also good in some patients when they become like tolerant to minoxidil. I start this. Uh, I'm not commenting on any particular specific brand. Mm, see, I use L'Oreal ammonia free color. Uh, okay, Vinayak, yeah, Roshan, Abhishek. Uh, yes. Okay. So now time to wind up. Huh? Sorry, I could not answer all the questions, but most of the questions I have tried to answer. And Stay tuned. We'll like next time when we make the I come live, then we'll sit together and discuss some more important things. ओके एंड थैंक यू लव योर सेल्फ और आप कुछ भी जानना समझना चाहते हैं तो आप हमें कांटेक्ट कर सकते हैं हमारी टीम पर टीम को वेबसाइट को विज़िट कर सकते हैं hairtransplantindia.co.in आपको बहुत सारा इन्फॉर्मेशन मिलेगा और मेरा कोशिश रहता है कि आपको मैं सिर्फ रिजल्ट्स ना दिखाऊं उसके पीछे की साइंस बताऊं उसके पीछे के कारण बताऊं ताकि आप अपने केसेस उसको ज़्यादा रिलेट कर सकें बिकॉज कई बार आप जो देखते हैं जैसा दिख रहा होता है उसके पीछे और भी बहुत सारी चीज़ें होती हैं सो थैंक यू सो मच फॉर स्टेइंग विद मी थैंक यू लव योर सेल्फ स्टे ब्लेस्ड